All right, it is 6 on the dot, so we are going to go ahead and get started. Welcome everyone to the Thrive series. We are excited to have you with us tonight. If you have attended a Thrive series program before, welcome back. And if you are new to the series, we are so happy to have you here for tonight's very special presentation. The Thrive series is a collaboration between Health Fairview and the Masonic Cancer Center at the University of Minnesota. Today is the 5th session of the 2022 Thrive series. So after tonight, we have just one left in the fall series. Tonight, we will hear from a trio of speakers. We have Tara Rick, Jennifer Pritchett, and Kelvin Hauer. Tara is a physician assistant at Health Fairview who has been caring for adult patients with cancer for over 16 years. Her clinical interests include cancer survivorship and sexual health. JP is the founder and owner of The Smitten Kitten, an education-based sex toys and supplier retailer in Minneapolis. JP also works in the advocacy space for adult industry product safety, consumer protection, and pleasure-based sex education for everybody. Kelvin is a therapist and has worked in sex education for the past 10 years. He specializes in working with kinky clients, non-monogamous clients, clients that work within the sex industry, and clients who are figuring out their sexuality. As always, we will be recording tonight's session and every session so that you can refer back to the recording on our website, which is z.umn.edu/Thrive series. And we edit every single session before we post it to ensure your privacy. As you may have heard me mention at the top of tonight's session, we are using the Q&A box to submit your reactions, comments, and of course, questions. And at the end, we will be posing those questions to our trio of speakers, Tara, JP, and Calvin, to answer your questions. And so with that, I will turn it over to them.
Great, thanks, Lisa and Amna and Kaya and all the organizers of the Thrive series. And thank you to all of you who are on this chat tonight. Thanks for joining us. We are really happy that you are here. And next, a couple slides to the objectives, please. Great. So I just want to tell you a little bit about what we're planning to cover in the next hour and what we're planning not to cover. And what we're planning not to cover are all the different ways that cancer can affect your sexual health. We know it does. That's why you're here. And it's a whole separate talk talking about all the different cancer treatments and what can happen. We know that this is a very common concern. It actually in one particular study came up as the 3rd most common concern after cancer treatment, and that less than half actually bring it up to their healthcare provider. So this discussion is really an unmet need. So what is this talk about then? Well, we have 3 objectives. And the first is we want to identify some common challenges cancer diagnosis and treatment pose to one's relationship with sexuality and intimacy, but more importantly, to normalize this conversation. Satisfaction with sexual health is associated with improved sense of quality of life and well-being, which is a common thread within cancer survivorship. And when it's not talked about, we feel isolated, and there's really no reason for that since this is so common. So again, we want to normalize this conversation. This is not taboo. This is your health and well-being. So the second objective is to give you practical tools and strategies to manage the physical and emotional aspects of your sexual health and intimacy after cancer. And we have 3 topics that we're going to cover tonight. And I'm going to give you a very brief overview from a medical standpoint. Calvin's going to then give you some tips from an intimacy perspective. And then JP will give you some more practical things that you can try on your own. Thirdly, we want to empower you. We want to discuss what to expect if you bring up this topic to your healthcare provider. We want you to be able to advocate for yourself. A couple caveats here. We're going to move fast. We have a lot to cover. And JP has taken notes for you in an amazing brochure that should be in the chat box. So you can go ahead and open that up, and you don't have to really worry about taking notes. Everything's going to be there for you. But what I do want you to think about is what questions that you have, and please write them down, put them in the chat box so we can have a discussion at the end. Couple other things, we are using gender inclusive language. We will be referring to folks with penises or vaginas. If I say the word or the terms woman or man, I'm referring to those assigned female or male at birth. I also want to make a comment that for sexual functioning, we're not just talking about genitalia. It includes the brain, which is not just a complex subset of neurotransmitters that we know are important for sexual health, but also what is going on with our mental and our emotional health. And then our spinal cord, our peripheral nerves, and our pelvic floor muscles all have to work together to make things work. So it's really a complex system. And next slide, please. So now we're gonna dive into our first topic, which is erectile dysfunction. Next. So those with a penis, erectile dysfunction is a really common sexual concern, irrespective of whether or not you're in a relationship or of your sexual preference. And the definition, the medical definition, is technically difficulty attaining or maintaining a penile erection for sexual activity that lasts for 3 months. And everybody's experience is so 3 months or longer. Sometimes people can have issues with erectile dysfunction that's really short and temporary, and we don't end up seeing it in clinic. But everybody's experience is different. So for some, ED can be really mild and temporary, and for others, it can be severe and persistent. And ED is not as technical as it sounds. Erection can be influenced by many different factors, including the type of treatment that you had, the partner related factors, what's going on in your relationship, what is your relationship with your body image, and mental health. Therefore, treatment really needs to be individually targeted to be effective. So if you bring this topic up to your healthcare provider, what might we do? We'll likely refer you to a urologist who might offer you medication like Viagra or one of the other phosphodiesterase 5 inhibitors. Depending on the situation, urology might also recommend vacuum devices, which JP will tell you more about, and or physical therapy for the pelvic floor. And sometimes they might also talk to you about penile implants as well. Next, please.
It's me now. Hi, everybody. So I'm going to just go over talking a little bit about intimacy, and there's going to be some themes that I'm going to touch on as we go through. I'm going to turn my brightness here. As I talk, we will have just a few things that I'll kind of come back to. And I think that there's the two themes I really want to like play into is thinking about like meaning making, like what is the meaning of a sexual act or, you know, body reaction, and then also looking at the language we use. So specifically, like when we're talking about erectile difficulties, I really want us to start to think about like, what is the meaning of an erection? What is the meaning of penetration? How does that play into a sexual relationship between folks, or you know, individually? And you know, how do we expand that meaning beyond certain like allowable acts? So kind of thinking about that. Other pieces too, when we talk about penises, we're not always the nicest. I think like even like erectile dysfunction can be kind of a tricky term, right? And so I think that if we can move towards expansive language and I statements around experience within relationships and move away from possible critical language or language that can feel just kind of like you're being put down, I think that can do a lot for an intimate relationship. Of course, you know, as Tara was kind of talking, like the idea of like our brain being a central part of our erotic experience and our intimate experience, and thinking about how do we bring in the brain, how do we bring in all of the body beyond just the genitals. Folks with penises are often really kind of like relegated to their penis when we talk about sexual function. And so if we can, bring in the conversation of like, you have a whole body connected to that penis, and that body has lots of different sensations. How do we explore that? And that, I think there's a lot of meaning making that we can take out of that. We're a very mechanically minded society as well, right? So sex is very taboo. And I think one of the ways that we handle that taboo is to really lean on like the mechanics of it, straight, direct, and to the point. And unfortunately, like, that's not really how sex works. And so I really want to welcome folks to maybe look at their experience and examine not just what is maybe a challenge right now, but what's working well or what's working good enough, and really kind of center into that embodied self. And finally, I think like being someone that does a lot of therapy with folks, I see so many people come in with erection concerns who are taking Viagra, they're taking, medications, maybe they got from a medical professional, maybe they got from a gas station, who knows? And sometimes even that can be, not the most helpful, because there's so much pressure that we put onto a penis to function a certain way. And when we put so much pressure on anything, our body's just going to automatically go into fight or flight. So the thing I always like to say to my clients is it's hard to want to be sexual when you're having a panic attack. And when we put all of that pressure, all of our hopes, all of our dreams on an erection, unfortunately, our risk of panic attack just goes up.
Mm-hmm.
Next slide, please.
So hi, everybody. My name is JP, and my slides are going to have the pictures on them, which is fun. Once you have done some of that work, just with self-reflection, like Calvin was talking about, and thinking about, what is the meaning of an erection and what kind of import do we put on erections, and for myself and for my partner, then you can start to think of in like practical terms, what can we do about erections that maybe aren't as frequent as we'd like, aren't as predictable as we like, maybe don't get hard at all, or it's, kind of in and out of being hard. There are things you could do, and a lot of doctors will prescribe what are called vacuum pumps in medical literature, but that's what penis pumps are. So penis pump is just like a non-medical term for a vacuum pump. And you'll see there's a little picture there on the slide. I mean, penis pumps are exactly what it sounds like. There is a cylinder that's usually made of acrylic that is attached to some kind of device that creates suction. So it could be like a hand pump, like the one you see here. Sometimes they even look like a bicycle pump kind of scenario. Sometimes it's just like a little bulb that you squeeze. And sometimes you can hook them up to an electric pump. So if you don't have enough strength in your hands or arms or dexterity to run a manual pump like that, you can still use it. And the concept is that you put a penis inside that cylinder with a little bit of padding around the bottom and some lubricant, and you manually create the suction that will help pull fluids into that erectile tissue. And then people use a penis ring, or the non-medical but sexual term for that is cock ring. And you slip the ring around the pump and then around the scrotum at the very base of the penis, and then disconnect the suction from the cylinder. And you can take the cylinder off while keeping the ring on to help hold fluid in the erectile tissue. So that is just one option to try. Another thing you can try. If you're thinking more about the pleasure part for the person experiencing, the person with the penis, that can be completely independent of erection or not, because soft penises and flaccid penises are, for the most part, capable of the same pleasure potential as an erect penis is. So there are lots of toys that are specifically designed for penises that are soft. Vibrators are a really great stimulation toy for all kinds of bodies, including penises. However, if you're a person who enjoys sexual scenarios where the penis is used for an internal massage of your partner or for penetration, that might not be as possible with a flaccid penis, in which case there are always your hands. Calvin did a really wonderful job talking about our whole body being sexual, and fingers are really wonderful massage tools that can be used for internal massage or to please a partner, obviously. Or there are insertable toys, and there are even strap-on like harnesses that are really designed for men to wear. And so there's just a few examples. All of toys like this, equipment like this is available all over the country. We're at your nearest sex toy store. So this isn't something that is necessarily like specific or exclusive to where I work. These are widely available. So yeah, I think that's about it. Is there anything else that you wanted to add on to that, Calvin or Tara?
Well, I think that something I always like to say is that like vacuum pumps and like there and some other materials that you can get at like the sex shop, you know, the medical version of it may be the exact same. It's just like thousands of dollars more and maybe covered by insurance. But yeah, the like sneak behind the curtain is like, it's the same stuff.
Yeah. Yes, that is particularly true with vacuum pumps. Yeah. All right, next slide.
And I just want to comment that, you know, don't be scared to go into your local sex shop. A lot of, you know, specifically, I know it's Smitten Kitten. I mean, everybody who works there is essentially a sex educator and really knows, you know, knows their stuff and has had these same questions a million times. So you are not, you know, alone in going there and talking to them about those things. But now we're going to talk about vaginal dryness, loss of elasticity, and painful sex. Next slide. So our second topic tonight. So I just want to start with a short comment on anatomy, because I feel like there's often some confusion here about what's the vagina and what's the vulva. And just briefly, quickly, the vagina is the internal part. It's the internal tube that connects to the uterus. And the vulva is the external part. And that's kind of what I have in the picture here. And you can see it's made up of a bunch of different structures like the clitoris, the labia, the urethral opening, etc. So just a comment on anatomy there. So for those with a vagina, vaginal dryness and pain with intercourse is really common. This is what I talk about almost every single day with my patients in cancer survivorship. And people don't always recognize vaginal dryness as the culprit of the symptoms. Sometimes people will come in and tell me how much itchiness they're having, that they're having frequent urinary tract infections or yeast infections that they didn't have before their cancer treatment, or pain with penetration. And typically this is caused by hormonal changes, either temporary or long-standing. That can be from things like chemotherapy, endocrine therapies, especially for breast cancer, or it can also be related to pelvic surgeries or radiation to the pelvis as well. And one thing that not a lot of people know is that long-term, so we have estrogen receptors in the vagina and the vulva, and long-term estrogen deprivation can actually cause some physical changes of the vagina, with actually shortening and narrowing. So if you bring up this topic to your healthcare provider, they'll likely recommend daily vaginal moisturizers and lubricants for sexual activity. And this also confuses patients. If I bring up moisturizers, the brain automatically kind of goes towards lubricants during intercourse. And they're two separate things. And JP is going to talk more about this. But I always, if you see me in clinic, I've probably said to you, think about daily vaginal moisturizing like you would moisturize your skin or your face. You do it every day. It's just part of your normal self-care. That's what it really is like with a vulva as well, especially after cancer treatment and with hormonal changes. And just with regular menopause as well. So depending on the situation, if moisturizers and lubricants aren't enough to control symptoms, sometimes we will consider topical estrogens. And you might be thinking, oh, I had an estrogen receptor positive breast cancer, that's not an option for me. But actually, it potentially is an option. There's very little, if any, systemic absorption. It's really just used locally to help control those local symptoms. And it is something that we do use pretty commonly in patients who have estrogen receptor positive breast cancer. So we just need to have kind of a conversation about risk and benefit with that, but that's an option. And then, for me, for example, I don't do typically a gynecologic exam. So if I'm concerned that you might have some of those structural changes like shortening and narrowing of the vagina, I might send you to OBGYN for an exam. And if they note that that's an issue, dilators might be something, vaginal dilators, something that can be prescribed, either something you can do on your own or with the help of a pelvic floor physical therapist. And I think JP might mention that as well. But the other thing is if there's a lot of overly strong pelvic floor contractions too, that make it difficult to have penetration or intercourse, that's something also that we might send you for physical pelvic floor physical therapy for. All right, next, please.
All right, so this is my jump on the soapbox and yell about communication slide, because communication is just so central to intimacy. And I think that a central part of my work, specifically when I'm working with couples, is making really mindful space for active communication and reflective listening. And I think that when we're experiencing these types of changes, or we're having some experiences with our genitals, if we're partnered, bringing our partner into that experience and exploring touch with an active communication, and maybe even modeling an active communication and active listening. So partner who is maybe receiving touch saying, I'm saying this, or sharing their experience, and their partner saying, I'm hearing you say that this is what you're feeling, is that correct? That can be a really great way to check in about experience and kind of continue that process so that everybody is feeling active in that time. Also, to normalize that maybe engaging with genitals solo may feel more empowering at first, and bringing partners in as you go might be a way to navigate that. I think that also, this is kind of going back to the experiential versus mechanical. When we bring our partners into a sexual situation that maybe feels a little more vulnerable, trust and vulnerability becomes a really central topic within that exploration. And within that, kind of setting some ground rules or some agreements around, if I need to stop, I need us to stop, and I'll tell us to stop. And that if that can, theoretically that should be heard, and we stop things. If there's agreements around stop, start, I like this, I don't like this, and active listening that goes into that, I think that this can build a greater level of trust and start to heal some emotional trauma that can come with these body changes. The tyranny of linguistics still hits us, though. The Milan Institute is notorious for saying, like, what we say matters, and language just so matters here. I'm not a big fan of penetration as a word. It just sounds so brutal, and, you know, for some folks, hey, that's great. But like for some folks, they don't love that. And I can imagine if there's pain, like vulvovaginal pain, penetration might not sound like the best word at that time. And so I really welcome to like collaboratively or even solo, like come up with some words that might feel better. Build a lexicon together. My favorite is encapsulation versus penetration, because our words have meaning and we create the meanings that they have. And of course, we want to invite the whole body into the experience. So, you know, I think that there's so much pressure on a vulva and a vagina to be a certain way as, you know, in sex. And, you know, I think that to explore, you know, various types of sensation with one's hands, with one's other body parts, with toys, etc., to get away from a focus on like just you know, something goes inside of a vagina, and really kind of say like, hey, this has all sorts of sensations, and let's try different things out and be open to that experience. Intimacy is cool, and intimacy takes a lot of vulnerability and trust. All right, next slide.
I'm glad that you just said that, Calvin, because I was just thinking when you said that words have meaning and we create the meaning, same thing with sex toys. A lot of people like will ascribe like if you're into this kind of toy or that kind of toy, that means this, but it doesn't. Like it's just a thing. It has no meaning in and of itself. Toys are just tools and they do what we want them to, and they have the meaning that we want them to. So I really appreciate you saying that, Calvin. And just as an aside too, for a lot of couples that haven't introduced sex toys or other kind of tools or pleasure devices into their sex life prior to now, it can be a really like vulnerable moment. So, I mean, that's okay. You know, like just be aware that things are going to like feel different to you when you have them in the package. And then when you get them out to be like, okay, it's time to use it. Like a lot of feelings are going to happen. And having that communication and vulnerability around what's going on is super important, and it's okay. And some things are going to be silly, some things are going to be embarrassing, some things are like maybe even upsetting. But we have to leave room for the whole host of things that might happen, and be careful with ourselves and each other around that. And changes to our body are like the most vulnerable things ever. And vaginal dryness, when we have such a cultural pedestal about the WAP, you know, the wet ass pussy, having not a WAP can like have feels. So anyway, I just wanted to acknowledge that and say it, and thank you, Calvin, for talking about that specifically.
And thank you for introducing the WAP into this presentation.
Yes. So like Tara said, there is a difference between a vaginal moisturizer and something that's designed to be a sexual lubricant. You'll see in the picture here, there is one product that I really love by a company out of the UK called Yes. And it is just called Yes VM for vaginal moisturizer. And this is a product that you can use daily right on the, you know, right by the vaginal opening, and also up into the vagina, which you can do with these little applicators, or you can put some on your hands or on a toy to help get it there. And that is something that you would do potentially every day. And over time, it will really help nourish and moisturize that mucous membrane and the skin that really, it's already delicate, but particularly after cancer treatments and experience, even more delicate often. So vaginal moisturizer, either a product like this specifically, or you can also use coconut oil based lubricant, can be very moisturizing, or just plain like organic coconut oil too. The only issue that folks might find with using just the plain coconut oil that is at room temperature, coconut oil is solid. So it's like not that easy to use. You're going to have to like get some out and warm it up in your hands first and then let it kind of melt into your body. But that is a perfectly acceptable and nice, like really natural way to add moisture to genitals. Now, that's the vaginal moisturizer part. If we're talking about lubricant, you want something that is going to be really good at reducing friction. And one of the very best things to reduce friction are silicone lubricants. Now, silicone is just the primary ingredient. That's not like a brand name or anything. It's like what it is. And there are hundreds of different options for silicone lubricants. And if you find like you're at the drugstore and you're looking at, there'll be a bunch of different lubricants and it'll probably be very confusing. Typically, and I don't know why this is, but typically the silicone-based lubricants are going to come in black bottles. So reach for the black bottle. I don't know why, that's just a thing. Reach for the black bottle first to save yourself some time and read the ingredients. And if the first ingredients say something like dimethicone or cyclomethicone, it's that ICONE, icone, silicone ending. Those are silicone lubricants. They're great at reducing friction. They're also widely considered hypoallergenic. So even the most sensitive folks with tons of allergies even are typically going to do just fine with a silicone lubricant. The other thing we can talk about, if the changes in the vagina have really required you to change the ideas of what kind of pleasure activities you can experience, and maybe any kind of stimulation on the outside or the inside of the vagina is just kind of a no-go right now, which that's a really common experience for folks. Then maybe just thinking about clitoral stimulation without vaginal stimulation can be a great way to get tons of pleasure, but without pain or discomfort. There is one vibrator. Well, when I say clitoral stimulation, that's what vibrators are. They're clitoral stimulators via vibration. And this purple one, I have a picture here. It's called the Erosilator, like Eros, E-R-O-S, and then oscillator, like a fan. And they make a specific tip for that is called the soft finger, but it looks like a marshmallow. And it's so soft, it's a pillow of air. So even if you've had thinning skin, sometimes something really gentle and soft like that can be super helpful. Yeah, do you guys have anything else that you want to add, Tara or Calvin?
Silicone lube is magic, but if you have hardwood floors or are in a bathtub, just know that you got to like clean it real quick because it lasts and lasts. Which like I know is kind of funny, but like also just like road hazard.
Yeah, seriously. And if you look in that PDF that is linked in your chat book, there is a whole section in there that went way more in depth about the different kinds of lubricants. So you can feel really empowered to make good, like educated lube decisions anywhere you are.
Oh, I have a thing I wanted to add. So one of the things that I will work with like clients around is bringing your own lube if you're going for a pelvic exam or anything. Like the medical lubes generally are not the like best when it comes to some of the ingredients. So if you find that you have a lubricant that works really well for you, feel empowered to bring it to appointments if there's going to be any use of lubricant.
Yeah, and a couple comments too is, I've had a lot of patients tell me that they actually have burning with some of the water-based lubricants like KY, Astroglide, things like that. So if that's been your experience, don't give up on lubes. Try other types. I also tell people if they're gonna be using coconut oil, which like JP said, is a great option, but it can stain underwear or sheets. So just kind of be aware of that. The other thing is if you are somebody who wears condoms in your relationship or relationships, just be aware that there are certain lubes that are compatible with condoms and others that are not. I think JP, I think in the brochure, I think there's some more information there about which ones are compatible or not.
Yes, yes. Thank you for bringing that up because that's really important. Oil-based lubes, by and large, are not compatible with condoms. They will break latex. So that's a really important thing to know. And I just wanted to put an exclamation point on something else you said. While water-based lubricants, as opposed to silicone-based, like we already talked about, they are ubiquitous. They're available everywhere. They are the most likely to cause irritation and problems with users, which is super counterintuitive. But that's why I focused on silicone lubricant, because, you know, if you just wanted like a quick and fast roll and you don't want to remember a bunch of stuff, silicone lube is likely going to work for all your purposes, for all your bodies. Water-based lubes are a little bit more complicated and they're really likely to exacerbate vaginal dryness, honestly. So thank you for bringing that up, Tara. All right, next slide.
All right, our third topic, final topic that we're going to cover tonight before we go to Q&A is low libido. So next slide, please. So I just want to clarify, you know, a couple things. First is just the difference between desire and arousal. In short, desire and libido are basically the same thing, and they come from the brain. It's the wanting to or not wanting to initiate sexual activity. And then arousal is the physical part. So it's the erection, the vaginal lubrication, it's the body's preparation for sexual activity. Now, important thing here is that these are not always concordant. Sometimes you can have arousal and not have desire, or vice versa. You know, this is not cause and effect or go one way or the other. But I just want you to be aware of kind of the definition of both of them. Also, because in the medical field, we love to label everything, whether it's helpful or not. I just want to comment that if you come to your healthcare provider and tell them that you have low libido or desire and it bothers you, then if we're going to make an intervention, you might see in your chart that we are giving a diagnosis of hypoactive sexual desire disorder. Again, adding that disorder word that can be very, you know, and have a negative connotation, but I just want you to be aware of that. And if you're sitting here thinking, I have low libido, but it doesn't bother me, do I have a problem? And the answer is absolutely not. That's kind of you need to kind of have those pieces. Low libido, it bothers you and you want to do something about it. So desire and libido is super complicated, just like everything else we're talking about tonight. It can be affected by so many different things. It's impacted by hormone changes, what medications that you're on, what is going on in your life in regards to stress, what's going on in regards to your relationship. Is depression an issue? Is anxiety flaring up? So in the clinic, if you bring this up to your healthcare provider, we really should be taking a careful history to see what we can do that could be potentially reversible. For example, are you on a medication causing it? And could we maybe try another medication? Because sometimes there are antidepressants. When it goes back to the neurotransmitters in the brain, there are certain activating neurotransmitters for libido and certain ones that kind of put on the brakes. So are there changes that maybe we or your primary care, whoever prescribed your antidepressant, you know, can we make some changes there? If there are relationship issues or some body image things we need to kind of think about working through, or some mental health issues at play, would you be open to meeting with a therapist to work through these things? However, we might also talk about working on arousal and seeing if for you that can then turn into desire, which Calvin and JP will tell you more about. Next slide.
Who put this slide together? There's so much information. What a jerk. So I think one of the first things I really want to just normalize is that, like, okay, this is going to sound silly. We live in a capitalist society, right? We're very like goal driven. You do the thing, but capitalism isn't always the most helpful when it comes to being sexual. And when I say that, I mean, like, we have put orgasm on this pedestal, right? And unfortunately, a lot of really great sexual connection gets talked down upon or gets glossed over in the pursuit of orgasm. Now, that isn't to say that like orgasm isn't like rad and amazing, because like orgasm is super cool. But you know, it's not the whole deal. And there can be some really amazing, really affirming sexual things that can happen that maybe don't lead to an orgasm. And I think that that's, I don't know, like that's something to really consider. Specifically, like, again, goal driven gets so complicated in this area. One of the things I always tell my students when I'm like training like newer therapists is like, try not to fall into goal driven interventions, because goal driven interventions really increase anxiety. So if we can say, hey, orgasms, they're really rad. Also, they don't have to be the whole deal. I think we get to feel other feelings.
Yeah.
Other thing that we lose out on when we like focus only on orgasm are all the awesome, yummy things that happen that are maybe like not inherently like genitally focused. Like thinking back, if you know, thinking back to your teenage years, remember making out and how like that was the best thing ever? Do you remember how there's still like memories specifically about making out that you may have that maybe even feel better in reflection than like having sex? We lose that. We lose that when we become adults, you know, whatever we call adulthood. Like we lose that at some point. And the thing that feels really nice about that type of play is it's centered on experience. It's centered on trying new things. It's just, it's really embodied. And so one of the things I really like to center for folks is, how are you allowing sex to be adult playtime? Because sex holds the same type of energy that we had when we were growing up and we were playing. Sex can be goofy, sex can be serious, sex can, you know, be all sorts of things. And if we can actively engage with it and bring in flirting and banter and, you know, costumes and whatever, like, I think that that can like really benefit folks. Another piece is just thinking about your relationship with your sexual self-esteem, which is like most people don't consider. Like, what are the things around sex that you feel like you just do really well and like make you feel really affirmed? Like, I do oral sex great, and that makes me feel amazing, right? How do we center that? What are maybe some relics that make you feel empowered? Like I said, costuming earlier, right? Like, is there clothing that make you feel really good, right? Is there like an object that makes you feel really powerful or really playful or really excited? Whatever we can do to bring in some of that theatricality to it, I think can really bring us out of living our day-to-day life of like, oh, I gotta pay taxes again, and bring us into like, I'm here by myself or with my partner or with my partners. I'm just having a good time. All right, I say all of that, and then I'm like, all right, and also sensate focused touch. And sensate focused touch is a little bit more goal driven, and that was sensate focused touch is an intervention developed by Masters and Johnson that certain therapists are trained in helping clients navigate sensate focused touch. And that is just a very slow, methodical process that integrates a like fancier version of like mindful touch. Sensate focused touch is really, it can be a really great intervention for a lot of folks. And if you want more information on that, Ojoy Sex Toy has a really good comic on on sensate focused touch. And finally, just making space for spontaneous versus reactive desire. Culturally, I think we're often trained to think that desire just kind of lightning bolts into our pants and was like, I'm ready, let's go. And maybe that's how it worked for us at various times in our lives. But generally, most people really kind of lean into a reactive desire. And reactive desire, like you build up anticipation, you build up into feeling more sexually aroused and more present. And so I'm not saying one is better than the other, but to make space for both like lightning bolt, like, oh my goodness, spontaneous desire, and also the slow build, the making out, the playing with costumes, the having fun with it. Next slide.
So there is a whole world of playfulness, like very accessible now. One of the things I really love is this 100 questions about sex. It is just literally like a bunch of like conversation starters that are good for like new people you're just meeting. They're good just to like reflect on yourself, and they're awesome for folks that have been married for decades. It's just a way to not necessarily even in a sexual scenario, like over your coffee and your newspaper on Sunday, you can get these out and just really open up conversations and have fun and see what you learn about yourself and your partner, especially partners that maybe you have known for a very long time, because there's always more to discover about each other. And as we grow and change, like we grow and change, like there's new things to discover about ourselves too. And there is a reason that sex toys are called toys. And it is just what Calvin said, like now that we're adults, we have this like permission to do things with ourselves and with each other that are fun. So if you can, you know, transfer that like wonder and creativity and exploration with each other, no matter what it is you're doing, you're going to have a good time. Like we've all had those moments, right? Where we like maybe doing something that doesn't sound that exciting, but it was fun because of the person you were with. And so, you know, because sex and intimacy can be so weighty, especially when we're dealing with cancer and other like huge stressors in our lives, sometimes those are like piled onto each other. Remembering that like could be fun is like a thing. And it requires an attitude of fun to go with it. So seek out that pleasure-based sex education. Even there's tons of resources online that are also a very few are listed in the PDF that you have access to through the chat. Because knowledge empowers too. Like a lot of folks will come in the store and like just kind of look at everything and realize they've come upon something they don't know what it is. Like literally, like what do you do with that? And some of those are like the best, most fun conversations, because sometimes you can see lightning bolts, like that lightning bolt like hit your pants, you know, like, oh, this is an idea. I didn't know this was even possible. And sometimes there are people like, whoa, that's kind of silly, but that's okay, because sex is also silly. So I guess just in closing, that's what I wanted to add, that there's a lot of things out there, and this moment in your lives could be an opportunity that you didn't sign up for, you didn't ask for necessarily, but it's here to like start discovering new ways to be sexual. And I think that could be really empowering, actually. And that's all I got for this one. Do we want to move on?
Got some take-home points that we want to focus on. So take-home points today, sexual health concerns are common and there are interventions. You know, of course, we did a light skimming of like a lot of subjects, and of course everything we could do a deep dive deeper and deeper. But to say, I hope that you're feeling empowered to know that, like, yeah, these concerns are a thing, but like there's people like working on it. There's people talking about it. There are people that want to talk about it with you. Um, of course, bring up the topic, advocate for yourself, specifically in the medical industry, like in medical environments. Like, they want to know, but sometimes they're afraid to ask. So if you start that conversation, if they shut you down, keep going for it. And to quote my friend Joan Price, if your doctor's giving you guff about it, you can always say, if you're not going to help me, I would like a referral to someone who will. And that's the final thing there. So as I'm reading the slide, I'm like, oh yeah, there it is. But yes, advocacy, like, sex is a central part of our lives and our experience, and it's valid, and it's valid that you want to be sexual. All right, done with that slide.
Oh, there's those extra resources I was talking about. So Joan, Calvin just mentioned Joan Price. You can find her at joanprice.com. She's specifically an advocate for ageless sexuality, and she's awesome.
She's the best.
She is the best. chronicsex.org. That's all resources and empowering information about sex and sexuality for folks with a whole variety of chronic medical health conditions. And afrosexuality.com, great website, awesome social media presence, really good practical pleasure-based sex education available there. And next slide.
All right, well, thank you so much, Tara, JP, and Calvin, for going over just some common challenges that cancer survivors experience with sexuality and intimacy, and for providing such helpful tools, tips, and communication techniques to assist in one's connection to their sexuality. So before we move on to some Q&A, I want to let you all know that a survey will be emailed to you tonight. So please don't forget to do that for a chance to win a prize pack. So we've had quite a few questions that have come in through the registration about sexuality and intimacy with an ostomy. So, and I'll kind of open this to the floor. Can you talk a little bit more about sexuality with an ostomy?
Yeah, absolutely. And we talked about this at our it was our conference this summer. So we do have actually a recording of that conversation that we had with a colon cancer survivor who talked a lot about intimacy and sexuality with an ostomy that I can put into the chat. But for those of you who aren't aware, sometimes for cancer treatment, part of the bowel or the bladder needs to be removed, and then a connection is made to the skin, and then stool or urine is collected in a bag. And really, I think the most important thing here is communication. There are a lot of feels when it comes to the changes after that. And what I've heard from survivors is also usually a lot of the it feels like a lot bigger deal to the person who's experienced it than it is to their partner. So just having a really open conversation about that is key. Being vulnerable and kind of talking through things, but also letting your partner know that they won't injure your stoma, but do communicate openly if something feels uncomfortable during sexual activity. And some practical things that you might already know, but if not, I just want to cover them, that there are mini bags that you can use during intimacy. So just to taking up less space. You could also secure them down with fabric. You can wear a t-shirt, you can kind of put a wrap around the ostomy. You can find lingerie that you don't have to take off to kind of secure that ostomy. There are pouch covers. You can even just use tape. But some other practical things are just take some time to empty the pouch or put on a mini bag or, do these things before sexual activity. And if you're worried, if something kind of that's bothering you in the back of your head is, could there be some odor? You can always burn a candle or some incense, which obviously sets a really nice mood anyway. There are a lot of resources out there. If you just actually Google sexuality, intimacy with an ostomy, you will find some good resources. For example, the GI Society of Canada actually has a really nice resource if you want to Google that. And I don't know, JP or Calvin, do you have anything kind of to add there?
Well, this just made me, when Calvin was talking about sexual self-esteem, the changes in their body, whether it be a stoma with an ostomy or the removal of body parts or scars, any number of like really intense body changes can bring up similar feelings for a lot of folks. So this is one that goes right to the heart of sexual self-esteem. So Calvin, when you were talking about that, I was thinking a lot about this question and knowing that you would have a lot of things to say that are really helpful and empowering around that.
Well, I think like, so there's a few things I'm kind of like marinating on right now. So one is seeing more and more like social media influencers who have ostomies who will talk about like, here's my like lingerie shoot, or here's like me out like not hiding this part, and like that kind of leading into a greater conversation of like, or a more visibility. And I think when we see things and we like, and it's normalized more and more, I think that, you know, it can help with like some of those like the sexual self-esteem piece. So like, yeah, culture, we can do better, we can normalize these experiences more. And kind of like pivoting into that idea of like, remember when I was like talking about being theatrical and creative? You know, maybe you don't want to do that all the time, you know, but like there are ways to like integrate, you know, costuming here to like hide that if it's something that you want to hide, or to maybe draw attention to different body parts. There's ways to kind of integrate it into a situation. And finally, I always think of Andrew Gurza, who's a disability and sexuality advocate, who is like, yeah, I make my partner take the bag off because that's part of the experience being with me. And like, you know, we're gonna normalize that. And I share that to say like, that doesn't have to be your experience, but to say that like, there are various conversations that can be had around this. And to whatever degree you want to show up to that, I hope that you feel empowered to speak openly about it.
Great, thank you all. So we have time for just one more question. What are good vaginal moisturizers and lubes for someone who prefers more natural products and also has a lot of sensitivities to chemicals?
Well, I think probably a number one choice that would fit all three of those needs is probably just some good organic coconut oil. Coconut oil in and of itself is naturally antimicrobial, antibacterial, and antifungal. So you will find things on the internet that are talking about for folks that have chronic or are prone to bacterial vaginosis or other kind of infections to maybe be careful about oil-based lubes. Usually a coconut oil-based lube, you're still going to be okay with, and it's worth a try. And with the coconut oil, you're going to get both. You can use it both as like a daily moisturizer. And you can also use it as a lubricant. Did you have anything you wanted to add, Tara or Calvin, to that?
No, that's what I would choose for in regards to answering that question as well.
Yeah. Yep. And that is lubricant ingredients, and like the real nerdy shit about lube is something that like Smitten Kitten is known for worldwide. So for whoever's question that is, if you ever want to just call the store, or you can my email's in the contact information, you can email me and I can give you options that are more specific to you as well. I would be happy to do that.
And then I just wanted to jump in. I had a boomer moment on the chat, on the Q&A section, and was like, oh, I was going to type an answer to the I feel completely uncreative on initiating. How do I begin? And then I accidentally hit I'll answer it live. So I'm going to answer it live. I'm going rogue, but I just want to just name that, like, this is very common. Initiation can cause a lot of anxiety for folks. If initiation feels really big, I would try to bring in your partner into setting up specific like times that you want to be sexual. So like sometimes people poo-poo the idea of like a sex date, but like I love the idea of a sex date. I think it's one of the greatest things you can do. And then the other way, if you're feeling uncreative on initiating, is like just be silly with it. Center silliness if you can. I think silliness and like humor can be really like endearing and fun, and just be like, hey, hot stuff, you want to go have sexual intercourse? Maybe that works, you know? So I hope that that's kind of helpful.
So there is just one more question that I think that we'll just go ahead and ask you all to answer. So this specific participant said that they have a partner who went through chemo and hasn't been intimate since, oh, sorry, the question just disappeared on me. Hasn't been intimate since they've gone through chemo about 5 months ago. So they are feeling sexually frustrated and have expressed that to them. What can they do to initiate sex with their partner who is undergoing chemo?
I think first it comes down to communication. You know, there might be a lot physically, emotionally, you know, kind of going on, you know, with your partner. And I think it's helpful for your partner to know how you're feeling, but I think it's also important for you to know how they're feeling as well. And maybe now isn't necessarily the time, but maybe you make a plan moving forward to kind of try to address everybody's needs. And there are things that you can also do on your own in the meantime as you're sexually frustrated. Is kind of what I would say. JP Calvin, what would you say?
I would, so not to be callous about it, but like this would be like, come see me, right? Like come work with a couples counselor if you have the means to do so. I think therapy can be really helpful for having this conversation start and continue, because I think that this can be a really delicate conversation that can cause injury in the wild, and having a space where there's a third party to kind of help moderate can be helpful. Otherwise though, like, yes, I think normalizing like sharing just like vulnerable feelings, and you know, centering empathy for your partner's experience, and you know, centering and also centering like, what does masturbation look like right now? How are you meeting, you know, your sexual needs? What feels accessible to you or not?
Thank you. I know we're out of time, so thank you for staying a little bit over to answer those questions that have come through. So before we wrap up, we just wanted to quickly make a special mention of thank you to everyone who continued to support cancer survivorship at mHealth Fairview through attending our Thrive sessions and viewing our content online. So with Give the Max Day coming up on November 17th, we just wanted to take this opportunity to share with you a link to support our survivorship programming efforts. We are truly grateful for your generosity. And so we'll go ahead and share that in the link in the chat box right now. So this does bring us to the end of our session. A huge thank you to Tara, JP, and Calvin for being here tonight and for staying a little bit over. So as a reminder, the recording will be available on our website by the end of this week. You will also be receiving an email, as I mentioned, shortly following today's session with a quick link to complete a survey, which will help us continuously improve. And you will be entered to win a prize pack full of all new stuff when you complete the survey. So we look forward to seeing you all next week at our final Thrive session for our fantastic presentation focused on blood marrow transplant with guests from the National Marrow Donor Program. And also, before we wrap up, you have a little bit under an hour here if you're in Minnesota for the polls to go out and vote, because the polls close at 8 a.m. So please get out there and vote if you haven't done that already. But thank you all so much for attending today, and a special thank you again to Tara, JP, and Calvin. Have a wonderful night, everyone.
Okay.